Assalamu alaikum wa rahmatullahi wa barakatuh. This is Fouad, and inshallah today we're going to talk about GIT Histology Crash Course. I know it's hard, this block, the GIT, the histology, but inshallah I'm going to try my best to make it easy, especially in the OSPs 20% and in the TBL it's like 12 or 13 objectives. So inshallah, I hope you enjoy. You inshallah, everything is gonna be okay with you guys. So let's start. So this was the first lecture we talked about in the previous video for me, digestive system one, the oral cavity and the tongue. I'm pretty sure like most of you guys watch it, so I'm gonna just skip it. The lips, we talked about it, the three layers, the external, vermilion, and internal aspect. The lip, we talked also about it, the oral cavity, the tongue, and the taste buds, and the linguinal papillae. We talked about the filiform, fungiform, folate, and circumvolate. So if you didn't watch the video, go first to that video and come to here. We talk about the taste buds also, where you can sense or feel the taste of everything. Posterior, and we talk about the junk salivary glands that secrete the mucus or lubricate and everything. We talked about the acini, serous mucus, mixed acini, and mesoepithelium. Um, we also talked about the salivary duct system in the previous video. Intercalated, striated, interloper duct, or main duct, salivary gland also. And we talked about the tumors and the disease of the tongue, and we solved the questions, and everything was clear, alhamdulillah. So for our first lecture for the TBL, second TBL, which is going to be digestive system 2, esophagus and stomach. Tamam. So again, this slide you're going to face it all along all the lectures. Tract, gland, accessories. We talked about it. It's very easy. Let's go right now to the general structure of the GIT tract. We have four layers of the GIT tract in general. Mucosa, which is the innermost, then submucosa, then muscularis, which is the muscle, and fourth one, it depends on the place. It's either way, adventitia or serosa. Adventitia is for the organs that they are not attached to mesentery. Mesentery, it's always supposed to be with serosa because it's like extension for it. So the serosa, you find it where? In abdominal cavity, right? So for our esophagus, tamam, it's not in our abdominal cavity. So most of it, until the exit last part of it in the abdominal, all of it in the thoracic. So it's gonna be adventitia, tamam. Mucosa is epithelium, lamina propria muscularis mucosa. Dense irregular connective tissue for the submucosa, which is also blood vessels, medullary plexus, which is the submucosal plexus. And for the muscularis, we have the our patch plexus, which is the magnetotic plexus between the circular and the internal muscle. Now let's talk about the mucosa very fast. I know it's a crash course, so we need speed run. Epithelium is for the esophagus. We have striated, squamous, non-keratinized, and it's thick because we need to protection it from the abrasions for the thing that we can swallow it. For lamina propria, as you can see here, so this is the first one. Lamina propria LP here, directly behind, directly under the epithelium, loose connective tissue, blood vessels. There's no blood vessels in the epithelium. Remember that. It's always in the basement. So the blood vessels, last thing is here, and it's go by diffusion to the epithelium. Muscularis mucosa, it's this one, and it's between the all the mucus and the submucosa. Okay, its longitudinal smooth muscle helps with the swallowing, separate mucosa from submucosa. Submucosa is the one up, هي كلها submucosa, sorry, and this one is submucosa. Esophagus is not a tube. It's also help to move the food by peristalsis movement اللي هي الحركة الدودية. It's like something like that. So it helped with moving the food. It also contracts and relax, and it's controlled by enteric nervous system, which is the enteric, which is we talked about them, which is the two plexus, the submucosa plexus and the myenteric plexus. Okay, submucosa, the one under the mucosa. It's dense, irregular connective tissue. As you can see, it's a lot, so it's dense, and irregular in different shape. It's not arrangement in one shape, so it's irregular. It has large blood. I'm sorry, large blood and lymph vessels, fibers, and ganglia cells. So as you can see here, you find a lot of supplies here, and also we have the masseter plexus, which is gonna be the submucosal plexus. تمام. Is that all? Did we talk about this thing? This thing is very big. What is this? You are right. This is the esophageal gland. Esophageal gland proper. It's also you can find it along all the esophagus, but it's more concentrated in the upper and in the lower regions. So the whole esophagus, in the beginning and in the end, these glands are very concentrated there. In the middle, you can find it, but not that much. We have also the duct, which is the exocytic gland. تمام. It composed from stratified cuboidal epithelium. It's secreting mucus. Why mucus? إيش فائدة الميوكس؟ lubricate ترطيب, protection from acid, which is the GRED. GRED, we're going to talk about it in a bit, which is the back flow of the acids from the stomach back, like بيطلع لفوق, like the acid's going to go up to the esophagus and it's going to burn it. So that's why the mucus is going to try to protect it. Mucus is not for neutralize. Remember that mucus of the esophagus is not for neutralize acid. It's just a diffusion barrier, only diffusion barrier to protect it. Put that in your mind, guys. تمام. Esophageal muscularis externa. This is now under the submucosa. Submucosa muscularis, which is the muscle. We have inner circular and outer longitudinal. We talk about it in physiology, in anatomy. Now we're in the histology. We can divide the esophagus to three parts: upper, lower, and middle. The upper one is striated, which is going to be skeletal. تقدر تتحكم فيه تحكم بسيط. And the lower is smooth. It's involuntary. Yeah, and in the middle, it's mixed, but it's probably most smooth. Then your esophagus, you cannot control it. So most of it is going to be smooth, and only the upper part is striated, which is skeletal. The innervation of these two muscles for the skeletal is somatic motor vagus. Motor because you can move it, like you can like control it. Smooth, you cannot control it, so it's autonomic. Autonomic, visceral motor vagus. The oral pouch plexus controls the peristalsis. So if I ask you what is the thing that controls the plexus of the esophagus, peristalsis of the esophagus is going to be the oral pouch plexus. Where you can find it? The metric plexus or back plexus. You can find it between the outer and the inner muscularis layer. So as you can see here, this is the longitudinal muscle and this is the circular muscle. Between them, you can find the plexus, which is the matrix plexus. As you can see here, this is longitudinal and this is the circularis. This one and this one, two types. In the middle, you can find this one, the yellow one, is the plexus, which is our back. Okay, last part, which is the outer layer. Esophagus, we talked about it. It's gonna be advantageous لأنه برا الأبdominal. It's out of the abdominal. So the outer layer of the esophagus is covered by advantageous except the lower part. Why? Because it's entered under the diaphragm, sorry, to the stomach. In this small part, تمام, but like directly will attach to the cardia in the stomach. The lower part of it, it's gonna be covered by serosa because there is a mesentery. It's a loose connective tissue, many blood vessels, nerve, and lymphatics. تمام? This one, as you can see. Finally, we finish from the esophagus. Let's go to the stomach. Okay, the stomach. We have in anatomy, we have the regions, we have the cardia, is the beginning here. This is the beginning of it. This one, as you can see, this one, the low part here, this one we talked about it, إنه فيها إيش؟ فيها serosa, no adventitia. The up is adventitia. Adventitia, serosa, now we enter the stomach. The first thing to, like when you face it, when you enter the stomach is cardiac, fundus, which is the top, but in the whole body, and here in the end, the pyloric. تمام. We can see there is a fund like folds. These folds we call it rugae to help to expand. When you eat more food to expand. طيب, the layer of the stomach. Again, the same thing. We have mucosa, submucosa, the muscularis, and serosa. Focus here, it's serosa, not advantageous. لأنه هلا نحن صار عندنا mesentery, صار عندنا laser و greater omentum. Remember that? تمام. ميكوسا it's a simple columnar epithelium فيها gastric beds. ايش الجاستريك beds؟ حنتكلم عنها بعد شوي، بس بما معناه الجاستريك beds is the open of a lot of glands, like a tube of glands, all of them They open in the gastric pits. So as you can see here, this is the mucosa, all of these. We have here the whole mucosa. We have here a lot of glands. The open or the neck, الأعلى إشي, the top thing, like directly open to the cavity of the stomach, we call the gastric pits. So the gastric pits from the gastric glands. تمام. Submucosa, loose and distensible. You can يعني contains the larger blood vessels. Muscularis is again inner circular and outer longitudinal layers. But the inner circular layer is also strength, يعني it like also got support from a third type of layers, which is inner oblique. So the oblique is the innermost. تمام. So we know that the only organ, put that in your mind, if I ask you where you can find only three layers of muscle in the abdominal on the GI tract, is the stomach. We have circular layer here, as you can see, and longitudinal. But also we have a third one, which is oblique, a small one oblique, to help the circular layer. Longitudinal, circular, oblique. Put that in your mind. Three layers. The inner circular layer is also strengthened by further inner oblique muscle. So the oblique is the innermost, بعدين inner, which is gonna be circular, بعدين the outermost آخر إشي برا longitudinal, as you can see here in the photo. تمام. بعدين عندنا serosa uh, covered by إيش ماي covered by mesothelium layer. تمام, as you can see here. So this one mucosa, submucosa muscularis, بعدين عندنا serosa بالتدريج from in to out. Fundic or gastric glands. We talked about them. They are present through all the gastric mucosa except the region where you can find the pyloric. So in the region you have either pyloric glands or the cardiac glands, or you can find gastric. So you cannot find both of them in the same place. تمام. It's extended from the bottom of the gastric beds to the muscularis mucosa. So the green one is the external muscularis mucosa, and this is the bits. So it's extend all the way. So you can find it. It's going deep. عم تحفر لجوا. It's going all the way deep, as you can see, all the way deep. This is the bits, the beginning, the gastric bit. This is the lumen. This is the lumen of the stomach. But then this is the surface. Goes all the way till it reaches the إيش اللي هي muscularis mucosa. We have the isthmus. Isthmus is the site of the stem cells. So it's like above the neck. As you can see here, this is the neck. تمام. Why is that? أيوة. As you can see here, this is the neck. تمام. The above it directly is the isthmus. Isthmus is like the place you can find the stem cells. Stem cells is for regenerate another cells. تجديد. Stem cells. طيب, we have five major cells types because it's gastric glands. So we have a lot of cells. What is these types of cells we have? We have mucus cells in the top, but then we have chief cells. They are so down, the purple one. We have the parietal, which you can find it in the middle, and we have the gastroenterocrine or the enterochromoferin cells. My bad. I'm sorry. Whatever. So, okay. And we have the stem cells. تمام. Okay, let's talk about them. Let's wait. Yeah, let me put it here. Okay, so we have here the surface mucosa. تمام. Surface mucosa cells, they secrete the bicarbonate. Why they secrete bicarbonate? For neutralize the acid. Bicarbonate is an acid, is an base, sorry, it's alkaline. فit will like face the acids in the stomach and try to neutralize. عم يعادل عشان it's not always gonna be acid. So decrease the acid a little bit, you're gonna reduce bicarbonate. Alkaline mucus for lubricate and protection and neutralize the acid. The turnover for the cells is from 3 to 5 days, يعني مدة عيشتها, and it's subalcolumnar. تمام. Let's put myself again here. Okay, for the isthmus, as we talked about, isthmus is the stem cells inside where you can find the stem cells, and they are the progenitor cells for the all other epithelium cells. So this is the center, تمام, of regenerate the cells. Now we're going to talk about the parietal cells. They abandon mitochondria. They have a lot of mitochondria. I'm going to tell you why in a bit. And the turnover lifespan for them is 150 to 200 days. They secrete HCl. This thing, I'm going to talk just a little bit about it. But I think my friend Abdurrahman Anani, inshallah, Allah يوفقه يا رب, he's gonna do the physiology crash course. So he's gonna talk about it more details in pyramid video, inshallah. But secrete HCl from the parietal cells, we have two things. We have the H and potassium ATPase, and we have the chlorine channel. The H plus and potassium ATPase is gonna secrete the H to the lumen. ال H هيطلع لبرا للlumen. وalso the chlorine or the chlor يعني channel Cl minus channel will also secrete the Cl outside. So the Cl outside will H positive outside, they're gonna combine together وthey're gonna be HCl. تمام. HCl ايش معناته؟ حمض الهيدروكلوريك. It's gonna be making the acid, the gastric acid. تمام. And also intrinsic factor B12 and convert the pepsinogen. تمام. For the endocrine cells, you just don't need to know all of these, but only focus on secreting peptides and the regulation of the water, electrolytes, metabolism, and enzymes, wherever. For the chief cells, we have secrete, very important thing, pepsinogen and lipase, and the lifespan is from 60 to 90 days. تمام. اللي بعده. Okay, type of endocrine cells. We have two types. It's very easy. Close and open. Both of them you find them in the basement. They are relying on they are rest on the basement membrane. But one of them they are not reaching to the lumen, so we call it close. With Tanya it's open because it's opening to the lumen. It's very easy. Pyloric versus fundic glands. We said no, we cannot find the fundic where there's a we cannot find the ploric where there's a fundic glands, and we cannot find the fundic where there is ploric. So they are not finding, like you cannot find both of them in the same place. For the pyloric, they are much longer bit and shorter glands, and mostly mucus, تمام, secretion of the mucus, and barely they have there's nothing like sheaf cells, like barely يعني rare هتلاقيهم. For the fundic, as we talk about, we have short bit but long gland, as we said, because it go deep. Mostly parietal, as you can see here, the red one. This is the red cells. They are the sheaf cells, parietal, and the sheaf cells, which is the purple or the blue, as you can see here. This is the sheaf cells. So you can find a lot of them here, but you cannot find here, less mucus cells. Lamina proprio, تمام, the other thing, is a scant cellular richly vascularized surrounding of the gastric bed and the gland, so they give the blood supply, associated with fibroblasts and cells of the immune system to protect. تمام. Muscularis mucosa, the last layer, which is separate. شايفين المسكولاريس mucosa وينها؟ ها هي. It's separate between the submucosa and the whole mucosa. Mucosa, a little bit thin muscle layer, which is muscularis mucosa, then submucosa. At the smooth muscle layer, longitudinal and transverse fibers help outflow of the gastric gland. تمام. This is the glands here, right? These are the glands. So these type of muscles تحت on the basement, they're gonna squeeze, contract. So when they're gonna contract, they're gonna contract or squeeze the glands to secrete their secretions. So it's gonna help the outflow of the gastric gland secretion. يعني هتضغط عليهم فهتضغط هيطلع الجلاندز وهيطلع السكريشن تبعه. For the submucosa, it's a dense, irregular. Wait, just let me remove. Yeah. Okay, dense, irregular connective tissue, elastic fiber, amount of adipose tissues and blood vessels. So as you can see here in the slide, you can find a lot of white areas. This is the blood vessels with adipose tissues. Submucosal plexus, or also muscle plexus, close to the inner muscular layer and innervating of secretory glands, vessels, and muscularis mucosa. This one, which is muscularis mucosa, muscular MB. This one, as you can see, MB, which is the muscular plexus. Muscularis, the last thing, which is the externa. As we talked, three poorly defined layers. Again, there are three layers: oblique, circular, longitudinal. But you cannot differentiate or appreciate them. يعني it's very poorly defined them. فخلاص, don't focus on it. بس اعرفوا إنه you can find the nerve fibers and the ganglia cells. They are present between the inner and the outer layers. So as you can see, CM means circular muscle, or longitudinal muscle. Sorry, longitudinal muscle. So you can find between them, you can find what? You can find the muscularis main plexus or back plexus. Also for the muscle relaxation, contraction and relaxation for the peristylus movement. The enteric nervous system, the ENS, For the GIT tract, it's the intrinsic autonomic nervous system. Put that in your mind. This is very important, guys. تمام. Uh, for the pyloric sphincter, there's not much to focus on it, but the pyloric sphincter at the level of the distal pyloric, uh, like it's a sphincter in the end between the pyloric and the duodenum, and it's covered by serosa. It continues with the parietal peritoneum and abdominal cavity. This is one you can see it. The last thing before we finish, the epithelium transformation zone. As you can see here, what is the transformation zone? Transformation zone is the sudden of a change on the epithelium directly from one to another. So as you can see here, this one is simple squamous epithelium (SSE), and this is simple columnar epithelium. Direct in this like حرفيا like فجأة suddenly it changed from squamous to columnar. That's why we called it transformation zone. As you can see here, this was the esophagus here. It was simple squamous epithelium, and the stomach was simple columnar epithelium. So it suddenly changed, suddenly changed. So we called it this zone as transformation zone. Finally, we finished from the stomach and esophagus. Alhamdulillah. Let's talk about the disease very, very fast. Gastrolithic disease, GERD, it's the content of the stomach with the acid goes backflow to the stomach to the esophagus يعني حرقة فبيطلع the food with acid all to the esophagus and burn it. So as you can see here, the esophagus get burned. For esophagus, the type of the muscle, type of the epithelium will change. Replacement of the esophageal striated squamous to the columnar. Put that in your mind. From striated squamous epithelium to columnar epithelium. Squamous to columnar. The esophageal cancer, also the same thing. For the disease of the stomach, we have the Zillinger-Ellison syndrome. This is very just like put it on your mind. And no, you have a lot of acids, tamam. Like there's excess secretion of the gastrin, a lot of acids. So the parietal cells, they're gonna like get a lot of excessive amount, like order to get more acid. So the stomach cannot neutralize it, like they cannot uh, like secrete a lot of bicarbonate to neutralize more acid, so you're gonna get ulcer تقرحات. يعني there's a lot of acid in your stomach and you cannot neutralize it, so the acid is gonna remain gonna get high till you're gonna get ulcers. Okay, alhamdulillah, we finished. Now let's go to the questions and answer sessions. Then stop the video if you want to answer the question. Okay, 41 years old female patient complained of a stomach problem when eating a high protein diet. What is the main product of the chief cells for the stomach which help the food to digestion? ايش عندنا حكينا chief cells? Right, it's the pepsinogen B. Okay, in parent esophagus, if you remember, what is the change in the epithelium? We said very important, guys. Right, it's from squamous to columnar, from the one which was in the esophagus to the stomach. Okay. The lining of the stomach is protected from acidic pH by buffering activity of the bicarbonate present in the layer of mucosa covering stomach lining. Which of the following cells create this productive ion? Which of the following cells produce the bicarbonate? It's very easy, right? The surface lining cell, the one on the top, you remember. Okay, alhamdulillah, we finished the first lecture. Now we have two more, which is the small intestine and large intestine. I need to stop recording right now لأنه حرجع أسوي ريكورد تاني عشان Canva it doesn't give me all the access. So, ciao. Okay, hello guys. So now we're gonna talk about the digestive system 3, which is the small intestine and pancreas. تمام? Yeah. Okay. Small intestine. We have three segments or three parts of it. It's the duodenum, ileum. تمام. And again, the structure of the small intestine, again, as we talked, mucosa, submucosa, which is dense irregular connective tissues, بعدين muscularis, بعدين serosa, and adventitia. Adventitia is where you can find, where you cannot find mesentery, so in the esophagus or in the rectum, transverse colon. بالنسبة للسيروسا, when there is a mesentery in the abdominal cavity, which is like intestine, small intestine. تمام. Placae circularis. Placae circularis. It's like a folds, as you can see here, that you find them in the small intestine. They are permanent transverse folds. They are include mucosa and part of submucosa. تمام. So mucosa and submucosa, they are folding together to like like shaping this shape or these folds, absent in the upper duodenum, prominent in the jejunum, and reduced in the ileum. So you can find them, most of them, they are in the jejunum, in the middle. In the end, they are a little bit in ileum, and absent in the upper duodenum. You cannot find them. What is the function of them? These folds, of course, increase the surface area and slow the key movement, which is gonna increase the reabsorption. لأنه if there's something go fast, the cell's not gonna get enough time to reabsorb things. So that's why it gives slower movement, so the cells can reabsorb وياخدوا راحتهم, like take more time to reabsorb things, you know. Okay, villi and crypts. Type. The villi is covered, as you can see here, is covered by simple columnar epithelium. This one, they are going like a tube going up. تمام. Simple columnar epithelium. This contains, as you can see here, the red one, which is blood capillaries, artery or vein, yani, lacteal, the also smooth muscle fibers. Are they increased? They also, the function of it, it's increased the absorptive surface and move the lymph via lacteal. تمام. So they increase the absorption. For the intestinal gland, these projections that are going down the opposite, we call them crypts, or the intestinal glands. Sorry, short, simple columnar tubular glands extend from muscularis mucosa, from mucosa to the muscularis mucosa, and again they contain stem cells, secretory cells. So as you can see here, this is the villi going up and the crypts going down, which contain the intestinal glands. Okay, cells of the small intestine. تمام. هاي الكريبتس. Okay, this is the crypts, the white area. We have here cells. What is these type of cells? We have five major cells. We have the enterocytes, global cells, beneath cells, M, which is macrophage cells, enteroendocrine cells, and stem cells. Now we're going to talk about the first one, which is going to be the enterocytes. Enterocytes is most abundant, but that in your mind, so you can find it everywhere. It's a simple columnar apical pressure border macrovilli. تمام. So as you can see here, the up is like فرشاية. تمام. It's like brush border by microvilli covered by glycocalyx. تمام. The function of it is to break down and reabsorb of the nutrients and transport to the blood lymph. So the most important function of the enterocyte is to break down. تمام. And absorption of the nutrients. As you can see, the villi here, macrovilli here, there are 1,000 per cell. So each cell have a lot of macrovilli. Form a striated border. So as you can see, it's like a border. Why? Because we want to increase the surface area, and they are increasing the surface area by 600 times. Yani, a lot of increasing for the surface area. As you can see here, the line, تمام, the border, macrovilli. Uh, this one, okay. Between them, down. The lipids absorb goes to the smooth ER, تمام, vesicles, smooth ER, SER vesicles, and they are packaged there. The lipids are packaged there as a chromomicrons, تمام. This is just a small like information you need to know it. For the global cells, as we took it in the foundation, the global cells is for mucus, right? So secrete mucus, protect and lubricate the intestine, and they are like flag shape, تمام. Increase from the duodenum to the ileum, تمام. So as you go through the small intestine, it increases more and more and more. So the first part of small intestine, a little bit, بس لما you go through all the intestine, more and more and more and more. That's why it's most abundant, most numbers in the ileum. But put that in your mind. Not all the GIT tract, only about the small intestine. لأنه the rectum, last thing, it has more and more and more and more. تمام? So we are, when I said most abundant, it's just only in the small intestine, the three parts, duodenum, jejunum, ileum. Penis cells, the main function of it is the innate immunity. قولا واحدا يعني, for the immunity, innate immunity. They are located at the base of the crypts, pyramidal shape, as you can see. تمام, pyramidal shape, and they have eosinophilic granules. والله زمان على granules. We took in the foundation. The granules secrete lysosome defenses, and phospholipase A2. اخوان we almost done. لا والله. Never give up, never give up. Okay, اللي بعده. M microfold cells. This micro fold cells, they overlie pair patches, antigen transporting cells. They are deliver they deliver the pathogens to the immune system cells. The immune system is down, تمام? So the pathogens are up. So they are like a gate. They take them down and deliver them to the immune system cells, and they will like fight them. So they have a microfolds, not a microvilli. They have microfolds, تمام? For the enterocrine cells, we talked about it in the stomach. Again, we have two types of the cells. We have the closed cells and the open cells. For the open cells, they are more common. تمام. For the stem cells, they are the progenerator. We located in the base of the intestinal glands. They are like down in the end. This photo, Dr. Khalid put it in his slide, is very, very good. It's like summary of everything. We have the mucosa, as you can see here, mucosa, submucosa muscularis, which is two type inner, circular, and outer longitudinal. And then we have the serosa, because we are in the abdominal cavity, and we have mesentery. So serosa with mesentery. Put that in your mind, guys. Villi, as we talked about it, and this is the submucosa and mucosa together. This is the serosa, inner muscularis longitudinal. This also we took there as artery, vein, and like tail in the villi. And this is the penis cells down. This is the enterocytes up, which help to absorb more of nutrients. Okay, laminar proper and of the small intestine. Sorry, of the intestinal villi. تمام. The villi of the small intestine contain blood, microvascular lymphatic capillaries called lacteals. So we have these lacteals, as you can see here. It's all lymphatic capillaries, تمام, and both innervation and smooth muscles. So we have smooth muscles, we have artery and veins, and we have the lacteals. So as you can see here, we find three things of them: artery, veins, smooth muscles, lymphatic capillaries, all of them. And we find the lymphatic nodules also. For the submucosa, now we finish from the mucosa and the menopropia. Submucosa, it's dense connective tissue, irregular as we talked about it, blood vessels, and it contains Werner glands. Werner glands, and you can find most of them in the duodenum. Put that in your mind, guys. Duodenum. Werner glands, it's alkaline secretion of the bicarbonate neutralize the gastric acid. لأن حكينا البيكربونات عبارة عن base. فبase is gonna neutralize the acid. They're gonna face each other optimal for the pH of the pancreatic enzymes. We have the GALT right now. The GALT is a gut-associated lymphatic tissues. They are the tissues in the ileum, most of them in the ileum. I think all of them in there. Like, okay, in the ileum, consisting of large lymphoid nodules aggregates. So a lot of lymphoid tissues aggregate together, known as barrier patches, تمام, underlying the epithelium cells. So underlying the epithelium cells, there's a lot of lymphoid tissues together. They're known as barrier patches. They are found in the ileum, تمام. Okay, this table is very very important, guys. Dr. Khalid put it in the slides. I tried to like put it in a good way in this slide. I search up for a good slides from a good websites. I got this, but this one is the same as this one. But I advise you guys to go through this one and see a visual like photos. Duodenum, ileum. For the duodenum, I'll put that. Where should I put it? Okay, here. For the duodenum, we have a Werner glands are in submucosal glands, so they are here, the Werner glands, and they secrete the alkaline mucus, which is the bicarbonate, rich bicarbonate, why to neutralize the gastric acid, to face the acids, to protect the mucosa, intestinal mucosa. For the jejunum, they are very prominent with the penis cells. Penis cells for what? For the innate immunity, for defense. No burner, no barrier, no guilt. Only penis cells. For the alien, defining features, the most like feature, like the landmark of the alien is the barrier patches. تمام? A lot of lymphoid tissues together. تمام? Barrier patches here, the penis cells in the basement, as we said, and we have the Werner glands. So we have three landmarks for each one. Duodenum, which is the for the Werner glands, jejunum, which is the penis cells, ileum for barrier patches. Okay. This one again, the same thing. We'll talk about the global cells. حكينا. We go through the small intestine. We have more and more and more global cells. So the global cells were most of numerous in the ileum. Duodenum, a little bit. As you can see, only one. بعدين هون 1 2 3 3 1 2 3 4 5 6 Allah. So when we go through the small intestine, increasing of the number of the global cells. Pancreas. It's a gland that have head, body, and tail, and we can define it as two like glands. It's exocrine and endocrine. هلا هي most of it is exocrine. Exocrine. That's why I put the sign here. And there's 2% of it. It's endocrine. But they are. It's mixed يعني in the آخر. The exocrine component synthesizes and secretes the enzymes into the duodenum, and we have the endocrine component synthesize and secrete the hormones, insulin, and the glycogen into the blood. So what is the difference? As you can see here, to the duodenum. Duodenum is an organ. تمام. To the blood directly. That's why I bought this one here. Just it's a very good thing to like to appreciate, guys. As you can see here, endocrine, exocrine. Just let's go directly. Exocrine secreted through the duct. Exocrine mean there's a duct. Secrete to go to what? To body surface and lumen of organ. That's why we said duodenum, as you can see here. تمام? To an organ. Uh, Also, produce what? Produce enzyme, mucus, sweat, and saliva. Examples like salivary gland, as we talked about it, the duct, تمام? The intercreated duct, interloper, high exocrine pancreas, digestive enzymes, and sweat glands. تمام؟ بالنسبة للendocrine, no ducts. That's why it goes directly to the bloodstream, directly to the blood capillaries or blood and veins or arteries. Secretion released directly into the blood. Produce hormones like thyroid, adrenal gland, and endocrine pancreas for the isolate of the pancreas. What's this? Whatever. Exocrine pancreas. Uh, it's as Dr. Khalid mentioned. It's simple as the parotid glands and the salivary glands. We took them. I explained them in the last video. But the only thing that here is special إنه الانتركalated it goes through the acids. هلا زمان لما أخذنا الأسينايز and the salivary gland, the intercalated duct, this is the acini, it stopped directly here. But in the exocrine pancreas, it goes in. So you can find it in the middle. So that's why you here to need to appreciate two things. As you can see here, the intercalated duct is going inside. شغلة تانية, second thing, we know that in the salivary gland, in the parotid gland, the cells are parietal, like in the peripheral side, like in the basement, in the outside. But as you can see here, this is a cell here. This is we call it centrosenal cells. Centrosenal cells means that there's a duct here. That's why from seeing these two cells here, nucleus here, we know that this is a intercalated duct going inside. So this is a exocrine pancreas. The intercalated duct actually begins within the acinis. The duct cells located inside the acinis are centroacinous cells. So as you can see here, the intercalated duct is going inside of the acinis under hormonal and neural controls. تمام. طيب, what is the hormones that like control it? We have secretin and CCK. Both of them, they are the principal hormonal regulators of the exocrine pancreas. So هم اللي they are controlling the exocrine pancreas. طيب, these two hormones, secretin and CCK, they are secreted by what? They are secreted by endocrine cells of the duodenum and proximal, a little bit proximal of duodenum. Secretin, the first one, it primarily stimulates secretion by ductal cells. تمام. أما CCK, it stimulates the enzyme secretion by acinar cells. تمام. Acinar cells. Yeah. For the pancreatic duct system, as in the salivary glands, we have the intercalated duct, which is add bicarbonate and water to the exocrine secretion. It's lined up by simple low cuboidal epithelium. and after that, as you remember, intercalated بعدين interloper بعدين main duct وهكذا. It's the same. Merge to interloper duct columnar epithelium بعدين interloper بيصير main duct وهيك وهيك. It's like we took it in the slide like that. طيب, the endocrine pancreas, it's about 1 to 2 percent of the volume of the pancreas, so it's a low amount. So as we said, most of the pancreas is exocrine gland, but a little bit of it it's endocrine. Most numerous in the tail, so you can find it in the tail. As we said, there's 3 regions. Actually, there's 4. عشان عاطف ما دكتور عاطف ما يزعل. بس the neck, the tail, the body, and the neck, and the head. Endocrine part of the pancreas has many capillaries, so the hormones can quickly enter the blood. So the endocrine has a lot of capillaries because it goes directly to the blood. So yeah, to reach the whole body, so the blood can go to through the whole body. The dark areas, the purple one, they are exocrine. That's why you can find a lot of dark areas, a lot of purple, and the light, which is the pink, a little bit here. These are the endocrine parts. تمام. So if you look through this slide, if I mark on this light small thing, it's endocrine, sorry. If I marked for the whole purple one, a lot of it, it's what? It's exocrine. Exocrine is the purple one. The pink one or the light areas is endocrine. That's why we find a lot of it, small amount of it. The endocrine pancreas, the cells صح cells of the pancreas. الدكتور هم ما حكى عنها in like more details, بس just go through them لأنه you cannot identify these under the microscope. حرفيا أنت حتشوفهم هيك. That's why you find them as a white area. If you remember here guys, it's a white area or light area because these cells are here. But you cannot differentiate, identify these cells. But we have 4 type of cells. We have alpha, beta, delta, تمام, and BB cells. تمام. For the alpha, it's from 50 to 20% of them, of these cells here, which is the what? Alpha, which is the pink one, and they for secrete glycogen. Allah Akbar. For the beta cells, it's 70% of them, which is you can see them by the purple one in the middle here, and they are for insulin. For the delta, it's for the somatos somatostatin تمام. For the PP cells, they are for secrete pancreatic polypeptide, minor number of the cells تمام. So it's a few, like minor number of the cells, so it's just a few amount, the green one. You cannot find all of them, يعني a lot of the PP cells. For the disease of the small intestine, finally we finish by the diseases. We have the celiac disease. هاي معناتها damage of or destruction of the villi. تمام. فthe villi is disorder يعني in the small intestine. فحيصير في عندنا damage للvilli اللي موجود عند الكريبتس caused by immune reaction against the gluten or other proteins. So like حساسية أو شي زي هيك. Like the villi of your mucous surface is gonna get like damage. Another disease of the pancreas, we have diabetes, as everyone knows, وعندنا pancreatic cancer كمان. Okay, we finished, alhamdulillah. Now we have the questions and answer sessions. طيب, what is the name of the small intestine cells that play essential role of innate immunity? دفاع, immunity. What was? Right, it's the penis cells. See. طيب, you have 2 slides of tissues, duodenum and ileum. What distinguishes the duodenum? Like what can let you know إنه this is the duodenum? إيش اللي بيخليك تفرق بين هي وهي? Right, it's A, which is the Berner glands. You can only find it in the duodenum. Which of the following is the most prominent type of cells in the epithelium of the small intestine? حكينا you can find it, a lot of it. Is it enterocytes ولا endocrine cells ولا globule cells ولا secretory crypt cells? Right, it's A, which is enterocytes. It's very abundant. I think we finished. Yeah, alhamdulillah, we finished the second lecture. Now we have the third one. Inshallah, يا رب ما كنت طولت عليكم. والله I'm trying my best. The record is almost like gonna finish, so I will stop it again. وحنبلش الlecture الثالث إن شاء الله. Okay, now with the last part of our histology crash course, which is the large intestine, the fourth lecture. Okay, so again and again and again والله تعبنا ونحن بنعيد track plant accessories uh, again. طيب, now we're going to talk about the large intestine. What is the main structure of it? We have the cecum, appendix, colon, rectum, anal canal. The cecum, where the ileum, the last part of the small intestine, drains to the large intestine, we call it cecum. So as you can see here, this is the ileum. It drains here with the cecum. بعدين عندنا appendix, which is the زائد الدودية. بعدين عندنا colon, which is ascending, transverse, descending, sigmoid. And we have the rectum or anal canal. طيب, what is the function of the large intestine? Of course, reabsorption of the water and erythrocytes. طيب, في عندنا there is also the global cells. The global cells, again, for the mucus, secrete large amount of mucus. Why? What is the function of the mucus? Facilitate or like help with elimination of the semi-solid and solid waste. الأشياء الفضلات الصلبة والأشباه الصلبة to like remove it. Mucosa, as we said, mucosa, submucosa, muscularis, whatever. Mucosa, smooth surface, as you can see here. No villi, no pellicae circularis. تمام. So you can only see smooth surface. Contains long striated crypts of lubricant. Crypts extend to the muscularis mucosa, so it's going deep, as you can see here, and goes up. This is the submucosa, sub M, so it's going down and up. Classic appearance, like the test tubes, like you can find it in the lab. الأنابيب تبعت الاختبارات, as you can see here, the test tubes, this one, this one, this one, this one. Smooth surface, as I said, no plaque circularis, no villi are present. تمام. Mucosa. The mucosal epithelium of the large intestine contains the same cells type of the small intestine except the penis cells. So there is no innate immunity or the penis cells in the mucosa of the large intestine. It's lined by a simple columnar epithelium called colonocytes or enterocytes with irregular microvilli, as you can see here. Hon, there's most important thing you need to focus on. And the simple columnar absorptive cells, they are the more dominant uh, in the most of the colon. تمام. So from the global cells. So the ratio is 4 to 1. So every four columnar cells you find one global cells. اللي مثلا columnar global columnar. But as you go through the rectum, near to the rectum, it became the ratio 1 by 1. Columnar cell, global, columnar cells, columnar. Like as you can see here. So this is the global cells. 1, 2, 3 of the symbol columnar, but then 1, 2, 3 of symbol, only one global in the middle. So the ratio will increase till become 1 by 1. 4 to 1 for the columnar, but then 1 to 1 columnar global in the rectum. Mucosal cells, enterocytes have an apical striated border of short macrovilli. هذا هو border, as you can see here, the striated border. These cells occur when the global cells which have apical mucin granules. هي الجرانيولز موجودة هون, as you can see here, above the global cells. The cell turnover for the enterocytes و global cells 6 days تقريبا عشان يتجددوا. For the enteroendocrine cells 4 weeks. Okay, now mm, we have the mucosa lamina propria. Loose connective tissue, very rich in galt. There's a lot of galt. We said it's a lymphoid tissues. So large lymphatic nodules, stored glands spaces. يعني it like goes through the spaces between the glands till it reach the submucosa. So بتخترق يعني the tissues between the glands till it became to the submucosa, extend to the submucosa. Distort gland spacing. For the submucosa, dense irregular connective tissue. Dense connective irregular connective tissue. سمعت يا جواد? It's dense, not loose. Okay, because we repeat it again and again. So sorry. So submucosa, it's dense irregular connective tissue again and again and again. Uh, it also has a blood and lymphatic vessels, minor plexus, fat cells, and lymphoid tissues, as you can see here. تمام. For the muscularis externa, again we have intern muscle which is the circular وouter which is longitudinal. بس في special features إنه ال outer longitudinal layer condensed into teniculae. So it became all of them like condensed together will become like a huge like longitudinal muscle, which we called it teniculae. Teniculae form the hystroculae. hystroculae. تمام. Teniculae form hystroculae. As again we said, the matrix plexus you find it between the outer and the inner muscular layer, longitudinal و longitudinal circular. طيب التينيكولاي ايش هي؟ عبارة عن 3 pads are present. So as you can see it's only one here, two, three. Like like no I'm gonna say maths بس يعني like فيها like واضحة إنه like there's something here, you know. One, two, three. They are present on the cecum and the colon, but they are absent of the rectum. تمام? So you can find them in the cecum and the colon, but they are not in the rectum. تينيا كولي. تمام. اللي بعده serosa لأنه there is a mesentery where the large intestine is directly connected with the other sections. Appendix زائد الدودية. أنا ودي أحط وجهي. Appendix and serosa of appendix. Appendix is epithelium, simple columnar, thick muscularis. تمام. So it's a thick muscle. Most feature, actually most important thing, and a large number of lymphatic nodules extend into this mucosa. So we have a lot of lymphatic nodules. Outer cover is serosa, continuous with the mesentery of the appendix. Because there is a mesentery, so we have serosa. Serosa of the appendix, epithelium simple squamous or mesothelium. The cell, as you can see here, of the serosa, it's a flatted, as you can see here. It's a flatted here down. So it's flatted cells facing the peritoneal cavity, underlying layer, dense irregular connective tissues. This one, the CT here, which is dense irregular connective tissue, under the mesothelium next to the outer layer of the muscularis externa. So this photo is explain everything حرفيا. تمام. We have the mucosa or the crypt, sorry, but then we have the aggregate lymphoid nodules, which is the galt, submucosa, circular, longitudinal pedenserosa, but then the mesoappendix. Okay, the rectum, last thing, we're almost done, promise. It's the dilated distal portion of the alimentary canal, so it's the last thing. So how we can differentiate between the rest of the large intestine and the rectum? The upper part is distinguished from the rest from the large intestine by the presence of the folds. We call it transverse rectal folds. So these folds, if you saw it, you know إنه خلاص you are in the rectum because you cannot find it in the other columns, you know. Above the anal valves, this is the anal valve, as you can see here. These anal valves are down here. Above it, there is a mucosa forms the longitudinal folds, which is called the columns of Morgagni. تمام? So these folds, as you can, the columns, this one here, 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 here. We call them columns of Morgani by the mucosa above the valve there, directly. تمام? Okay, the rectum. The rectal mucosa, lined by simple columnar epithelium. It lacks from villi, has a smooth surface, very long gland, a lot of globule cells, a lot of globule cells. That's why I told you guys the globule cells increase as we go through the GIT track. Nice. It lacks a mesentery. If there is no mesentery, what's gonna be the outer layer? Adventitia. If there is a mesentery, serosa. If there is no mesentery, so it's going to be adventitia. So the rectum wall, no mesentery, معناته the outer layer is going to be adventitia. Almost there, I promise. This is Karim, by the way, my friend, my brother, sorry. The anal canal has the internal. Okay, we have two sphincters. We have external and internal. The internal anal sphincter is thickening because the inner circular muscle. Like so my home شوي بس بالصورة a little bit بس. Here you can find the muscularis, the orange and the red one. The orange is the inner circular muscle, and the outer is longitudinal. The circular continue to come here on these two sides. In this side, تمام, we call the is internal sphincter. طيب, and we said the external sphincter is very thick. Why? لأن the orange one is thick. That's why the internal inner sphincter is thickening of the circular inner layer. So it's thick because the muscle itself is thick, you know. The external one, which is gonna be this one, the red one, is a skeletal muscle, and you can like control it, and it's part of the pelvic floor. So as you can see here, this is the internal anal sphincter here, and this is the external anal sphincter. It's a skeletal muscle. تمام. Hey, there's the valves that we talked about. These the columns that we talked about. Rectum, lymphoid follicles, everything. Yeah, everything is good. تمام. This is the internal anal sphincter because the circularis muscle, and this is the external anal sphincter from the skeletal muscle. تمام. تمام. اللي بعده the different definitions of the subdivisions. هاي الدكتور حكى عنها شوي هيك موضوع غريب شاطح. حكى إنه the definitions and subdivisions. uh, ف there's like more different terminologies for the anatomical anal canal. If I said anal canal for the anatomy, it only stays here. تمام. If I said histologic anal canal, it's above the valves, like in the end of the columns, Morgani. If I said surgical anal canal, it's gonna be here, L till A, just like that. تمام. Rectoanal junction. I think it's the last thing or before last thing. Rectoanal junction is it's like a junction where, as we said, there's going to be transfers of the epithelium, so it's going to be changed a lot. So the simple columnar epithelium of the rectum, as you can see here, this is the rectum. Simple columnar will change directly to become a stratified cuboidal and squamous in the anal canal. So شايفين شلون transitional zone rectum كانت columnar صارت cuboidal and squamous, so it changed directly. So in this here we called it rectoanal junction. Recto from ايش؟ from rectum, وanal from anal canal. This epithelium then changed to keratinized stratified squamous epithelium at the anal of wrist. Why? Because it's become a skin. For if we have a skin, we cannot be keratinized. تمام. Last thing, the hemorrhoidal veins plexus of the anal cavity اللي هي البواسير. At the base of each anal column, the submucosa house the final branch of the superior hemorrhoidal vessels. So in the end, you can find the superior hemorrhoidal vessels. There is اللي هي البواسير اللي هي hemorrhoids. تمام. Why it became? Because these vessels it became dilated or large or heavy. So at the end, they're gonna like damage, and you will feel the pain. So hemorrhoids are caused by the heavy or large venous plexus at the end of the anal columns. Okay, the disease. Okay, now we have the disease of the large intestine. We have the colorectal polyps. It's a growth lining either the colon or the rectum or the like large intestine growth or mass. تمام. And sometimes it's like painless. You cannot feel the pain. Okay. But if you keep it there, it's gonna be cancer. So the doctors tried to remove it before it came to cancer. So that's why like you should like even if you don't feel pain, you need to remove it because it's maybe become a cancer. This is the cancer that we were talking about. As you can see here, this is the growth. بعدين تكبر it become a cancer. تمام. Now we have the Hirschenberg disease. It's very easy. The absence of metric and some mucosal plexus. So there's no ENS, which is the uh, enteric neurons. تمام. And this disease is like most abundant in the people would they have Down syndrome. تمام. So you can find it there. Okay. Question and answers. Alhamdulillah. صوت cinema. Okay. Last thing. Which of the following features is characteristics of the mucosa of the large intestine؟ شو شيء كثير مميز باللارج intestine يا اخوان حكينا long striated crypts of Leblanc. ركزوا عليها هي جدا جدا important. Which cell type is absent in the epithelium of the large intestine؟ Exactly, it's the penis cells. No, we don't have the penis cells. We said everything we have them, all the cells we have them except the penis cells. تمام. Okay, this is the clinical scenario. Last one. A 50-year-old man present with the chronic conceptions and abdominal since childhood. Imaging shows marked dilation of the sigmoid colon. Rectal biopsy reveals absence of the ganglion cells in post submucosal and matrix plexus. So there is an absence in the ENS, in the enteric nervous system. So what's the diagnosis is gonna be? It's gonna be the Hunter-Bird disease. C. Right. بس الله يعطيكم ألف ألف عافية. الحمد لله رب العالمين. أتمنى إني وفقت بالشرح. My first crash course. It was a hard work والله, like for the whole week. إن شاء الله إنه يا رب تكونوا استفدتوا. I'm sorry if I forget something or I skip something. بس I tried my best والله to cover everything لأنه جد الماتيريال is so heavy و limiting time before the TBL. الله يوفقكم وييسر لكم أموركم يا رب. I hope you enjoyed. وبس والله كان معكم فؤاد. أشوفكم إن شاء الله في other pyramid sessions. السلام عليكم.